So we have our pelvis here, okay, front and back, all right? Pelvic floor sits on the bottom, okay? When our pelvis is more in this position, we have a narrow infrapubic angle here, okay? That's narrow, and it puts the pelvic floor in a position where it is actually eccentrically oriented, okay? You can think of it like a trampoline where it's kind of lengthening like this as the pelvis moves. So when the pelvis moves the other way and we get a wide infrasternal angle, you're gonna see the pelvic floor actually lift and contract a little bit, like a trampoline that's getting a little bit more tension, okay? So pelvic floor lengthens, pelvic floor contracts, okay? When we are in more of this pelvic floor lengthened eccentric position, we're also in an environment where in the back of the pelvis, we have tightness of the PIriformis muscles that sit back in here, as well as glute max is really kind of clenched and tight, okay? So when you have somebody who's walking around with butt pain, okay, you need to think about the fact that their pelvis may be in this kind of orientation, where the pelvic floor is over lengthened and not getting enough contractile stimulation. Okay, so if you can get somebody to regulate their pressure better through breathing and understand how the breath can help to activate their pelvic floor, you're going to take them from this environment more to this environment, which is going to help give them better length out of their piriformis and their glutes to get them out of pain, okay? In addition to pelvic floor working, when we create more of this environment for the pelvis, we get more TA activation in the front. Okay, so less over lengthened TAs, contracted TAs. And again, you're going to create some space back here for somebody who has pain in the back of their hip.